Breast and feeding. Outline. Introduction. The advantages of colostrum. Advantages of breastfeeding for the baby. Reflexes with breastfeeding. Technique of breastfeeding. 10 steps of successful breastfeeding. Advantages of breastfeeding for the mother. Introduction. Once oxygenation and temperature is maintained, breastfeeding should be started within half to 1 hour. It is best suited for a newborn. It is not only species-specific, but also baby-specific. It contains all the nutrients for normal growth and development of a baby, from time of birth to first 6 months of life. The advantages of colostrum. For the first 2 to 4 days of baby's life, mother's breasts will secrete colostrum, a yellowish fluid rich in proteins. These valuable proteins are essential to the development of a healthy immune system. The protein is easily digested and absorbed by the body, especially by the rapidly developing brain. Colostrum provides factors that promote maturation of the gut and good digestion. Colostrum is the most superior and well-designed nutrition for the baby in the first few days of life. Advantages of breastfeeding for the baby. Superior nutrition. There is an increased resistance to infections, and therefore fewer incidents of illness and hospitalization. Decreased risk of allergies and lactose intolerance. Breast milk is sterile. Baby experiences less nappy rash and thrush. Baby is less likely to develop allergies. Baby experiences fewer stomach upsets and constipation. Breastfed infants tend to have fewer cavities. Babies benefit emotionally because they are held more. Breastfeeding promotes mother-baby bonding. Reflexes with breastfeeding. Rooting reflex helps baby to find the nipple and proper attachment to breast. Suckling reflex helps the baby draw out milk from mother's breast. It consists of drawing in the nipple and areola to form an elongated teat inside the mouth, pressing the stretched nipple and areola with jaw and tongue against the palate, drawing milk from lactiferous sinuses by wave-like peristaltic movements of the tongue, swallowing reflex. Technique of breastfeeding. Position. Latching. Burping. Adequacy of breastfeeding. 10 steps of successful breastfeeding. Have a written breastfeeding policy that is routinely communicated to all healthcare staff. Train all healthcare staff in skills necessary to implement this policy. Inform all pregnant women about the benefits and management of breastfeeding. Help mothers initiate breastfeeding within a half hour of birth. Show mothers how to breastfeed and how to maintain lactation even if they should be separated from their infants. Give newborn no food or drink other than breast milk unless medically indicated. Practice rooming in. Allow mothers and infants to remain together 24 hours a day. Encourage breastfeeding on demand. Give no artificial teats or pacifiers, also called dummies or soothers, to BF infants. foster the establishment of breastfeeding support groups, and refer mothers to them on discharge from the hospital or clinic. Advantages of breastfeeding for the mother. The baby sucking causes a mother's uterus to contract and reduces the flow of blood after delivery. During lactation, menstruation ceases, offering a form of contraception. Mothers who breastfeed tend to lose weight and achieve their pre-pregnancy status more easily than mothers who bottle feed. Mothers who breastfeed are less likely to develop breast cancer later in life. Breastfeeding is more economical than formula feeding. There are less trips to the doctor and less money spent on medications. Breastfeeding promotes mother-baby bonding. Hormones released during breastfeeding create feelings of warmth and calm in the mother.